We must start our lecture, and I hope next class all students will enter the Zoom system on time. Today we will talk about the second part of the second module of the radiology, dedicated to the X-ray imaging. In previous semester we studied nuclear imaging techniques, we studied the radiation therapy, and during this semester we will talk about only X-ray imaging, about the computer tomography, and about the magnetic resonance imaging. So our main objectives of this lecture is to answer such questions like how do X-ray create an image of internal body structures, what are the 5 basic radiograph densities, try to hand and interpreting several medical imaging cases. If we will look at the main diagnostical techniques which we use in the clinics, on the first place there will be plain X-rays. Everyone knows this method. It's very commonly used and easy to perform method with a low radiation dose. On the second place, probably there will be CT scan. During this modality, we also use X-ray waves, magnetic resonance imaging. In case of MRI, we don't use any ionizing radiation, and nuclear imaging techniques like bone scintigraphy, positron emitting computed tomography, single photon emitted computed tomography, and some other techniques. So as you can see, we got a lot of different methods, and I want again to ask you, can you mark the techniques which use ionizing radiation? I will name the technique and you will say yes or no. You can unmute yourself and say yes or no. So plain X-ray, do we use ionizing radiation?
I believe yes, sir.
Yes. X-ray waves, sure. CT scan, do we use ionizing radiation to perform this imaging technique?
We use the same X-ray, so maybe no, sir.
Yeah, we use X-ray waves, the same high energy radiation. So we use radiation. Then MRI, do we use radiation, ionizing radiation?
No, sir.
No, sir. I don't think so.
Don't use ionizing radiation. Okay. And what about nuclear imaging?
PET scan, proton emission tomography. Maybe yes, sir.
Yes, we use gamma waves. We studied this technique in previous semester. We use gamma waves. And what about ultrasound, USG?
No, sir.
No, sir.
Don't.
Ultrasound with sound waves, yes.
Mammography?
Mammography, yes, sir.
Yes, we use X-ray waves. Angiography?
Angiography, yes, sir. We use alpha. No, but yes, sir. I think
sure, we use X-ray waves for angiography. It's study of the vessels. Mammography, it's the X-ray study of the mammary glands.
Yes.
And fluoroscopy? Fluoroscopy? Do we use radiation?
Yes, sir. Yes, sir.
Yes, we use X-ray waves. As you can see, most of the imaging techniques we use radiation, ionizing radiation, in order to perform them. So what is medical imaging in general? The primary purpose is to identify pathologic conditions. It requires recognition of normal anatomy, but you remember from the previous semester when we worked with the scintigraphy scanning, you remember that not a lot of anatomical information could be obtained from the nuclear imaging methods of visualization. Yeah, if we talk about the X-ray imaging, if we talk about the CT imaging, much more information about the anatomy could be obtained from those imaging. When we will talk about the plain X-ray imaging, we know that we use X-ray waves. They have their physical properties, like they have no mass, no charge, they have high energy, and plain X-ray imaging gives us a lot of anatomical information. You can look at this image and see that a lot of different structures can be very well seen, and their parts, even on microscopic level, if the device is good, contemporary, digital device, X-ray device, we can achieve a lot of information, and it's sometimes even easy to interpret even without any knowledge. So if you will look at this image, right, now you can precisely say what is the diagnosis here.
Oblique fracture of the fibula.
Yeah, this is the fracture. Even the person without medical knowledge can say that this is the fracture. So it's very useful, high informative, very important method of diagnostics. Let's say a few words about the basics of X-ray physics. You know that X-rays, it's a form of electromagnetic energy which travels at the speed of light, and you can see the place of the X-ray waves in the whole electromagnetic spectrum. Gamma rays, we use them for the nuclear imaging techniques. Yeah? And if we will look at this scheme, it's very beautiful and high informative. We can see that X-ray will be placed here among other types of the waves. It's a radiation type. Wavelength, they have small wavelengths, approximate scale of wavelength relatively to the objects. It's on the level of the molecules and atoms. Yeah, for instance, visible light, it's on the scale of the protozoans on the cells. Yeah, and microwave have a very big wavelength on the level of the size of the humans. And this is the frequency. Also a colorful chart. You can see the place of X-ray waves and also gamma ray. Gamma waves, we used them in the previous semester in order to perform nuclear imaging, like a bone scintigraphy, positron emitted computed tomography, single photon emitted computed tomography. When the X-ray waves pass through the human body, different things may happen, and you, even without big knowledge in X-ray, you can say that if you look at this image, you can say where on this image have X-ray passed through the body to the greatest degree.
The lungs?
I repeat again, think about this question. Where on this image have X-ray passed through the body to the greatest degree?
So do you mean penetration?
It means where the X-ray waves penetrated body without any problems, without any serious obstacles.
The muscles, the skin, maybe the organs, the viscera. Because the darker the image is, the more easier it is.
Actually, it's a little bit tricky question. Yeah, but you will have a fun when you will hear the answer. So,
is it bones?
If we look at the whole image, so we talk about the spaces where the X-ray wave passed maximally free without any problems, without any obstacles. So if we will look at this corner, upper corner here, and here, this is outside the human body, yes, outside. So here, X-ray waves passed maximally free without any problems. Yeah, but you was correct when you said that lung tissue allowed X-ray waves to pass maximally free, and the answer was correct if we will talk only about the human body on this image. Yeah, so how do we call the regions where the X-ray waves passing maximally free without any problems? How do we call? Do you know? Today,
No, sir.
this week, some students already started learning. They already had a first para, so they prepared for this first para, this terminology. We got such a term like radiolucency. Radiolucent structures, those structures which allow to pass X-ray waves at the greatest degree. They usually look dark, like gases in the bowels, gases in the lungs. So if you look into the intracostal spaces, yeah, these quadrants, you will see that they are darker compared to other structures. It means they allow to pass the X-ray waves at maximal degree, yeah. And opposite to that, the brightest parts of the image, yeah, we call this region radio-opaque structures. Radio-opaque structures which do not allow to freely pass the X-ray waves through the body. They are usually bright, like bones, teeth, calculi, and so on, calcinates. So let's return again. Which things may happen when X-ray pass through the human body? Pass all the way through the body, be deflected or scattered, or be absorbed. X-ray passing through the tissues, yeah? If we look at this image, we can, without any problems, say what is the diagnosis here. Look at the image. And other students also, I invite you to take part in our discussion. What is the diagnosis? Very easy to say. Can you tell, do you see any abnormality on this X-ray image?
Yeah.
Where?
The kidneys, the intestine, cecum looks really dark. The kidneys.
This is outline of the kidney, 1 and 2nd. So I don't see any problem here.
But so the left kidney, there's a dark space in front of it. Couldn't that be a
this
problem?
or this? Left kidney, this.
The one on the left, the one on the left. Yeah, the both things, the dark spots, they are not normal.
So I will tell you instantly, in the right from the beginning, this part, this dark part, this dark part, this dark part, this is the gas inside the intestines, in the bowels.
Okay.
It's a bad preparation of the patient, but actually it's not abnormality. It's just bad preparation for the study, yeah? Because we should perform enema before the study, sometimes twice. And I can see this region, this bright radio-opaque region, in the projection of the, which organ? Stomach.
Okay, stomach.
Yeah, maybe also we can see gas in the stomach here, yeah? So this is the foreign body, like for instance, coin, yeah? Foreign body, it's totally radiopaque, it's not organic. It's totally not letting X-ray to pass through this region. How the X-ray passing through the tissue depends on the energy of the X-ray and the atomic number of the tissue. The higher energy X-ray, more likely to pass through. And the higher atomic number of the tissue or foreign body, for instance, yeah, or metal, the lesser degree X-ray waves will pass this region. And high atomic number, more likely to absorb X-ray wave. So as you can see here, the metal with a high atomic number compared to the organic parts of the image, compared to the tissues, this region completely absorbs the X-ray waves and not letting them to pass through this region. How do the X-ray waves passing through the body and create the image? The X-ray that pass through the body. I'm sorry, dear students, if you're not answering, please mute yourself because I can hear my voice and I can hear all the time reversed distortion of my voice. So if you're not answering, please mute yourself. and unmute only at the time when I'm asking. Sign. Abhishek.
Yeah,
You
sorry.
mute yourself. Okay. So X-ray that pass through the body to the film render the film dark, black. As I already said, radiolucent spaces. X-ray that are totally blocked, do not reach the film and render the film light, they are bright, radio opaque. The first is radiolucent and the second is radio opaque. Air, it's a low atomic number and it allows to X-ray to pass through, and that's why the image is dark. Metal, like in the previous image, got high atomic number, blocks X-rays, that's why the image is white. You must remember the 5 main radiographic densities, very easy to remember, and when I will switch on the text, you should say the number on the image which corresponds to the type of the radiographic density. So you can see the first variant, it's air. So please tell me the number of on the image.
Number 4, sir. You already discussed.
Number 4, we already discussed it. Okay, that's correct. Fat. Fat.
Number 2.
Probably number 2. Yeah. Soft tissue fluid. We can see outline of the kidney here. Yes, outline of the kidney. So this is soft tissue. Yes, soft tissue. Mineral density. What means mineral? Something organic.
Calcium. Yeah,
Calcium.
maybe 3.
3, bone. That's correct. Here, vertebrae, pelvic bones, ribs, their anterior and posterior surfaces.
Mm-hmm.
And metal, it's clear that this
Is number 1.
Number 1, yeah, that's correct. Now you will try to tell me the type of the radiographic density. I will point my mouse on the different parts of the image and you will tell me and you will name the radiographic density according to the classification from the previous slide. So if I will point on this part, this is which type of?
This will be mineral, sir.
Mineral density, bone, yes, mineral density. If I will point at this place, it will be?
Gas,
air. Air, yeah, that's correct. If I will place my mouse here.
Soft tissue.
Soft tissue, fat, soft tissues, yes.
Okay.
Soft tissues mainly, yes. And here?
Metal.
Metal. That's correct. Very pretty image which illustrates again the radiopaque structures. The history of the disease, it's, I think my dog swallowed a rock. And diagnosis, yes, he did. Because we can see it's not human organism, but still we can see here the same principle, yes, of interpretation. We can see a rock, the very dense structure that actually reflects and absorbs X-ray waves. The basic principles of the image interpretation, the work with the digital and analog X-ray images are dedicated light source. We must have darkened environment like a movie theater and limit distractions. And here on this image you can see the digital X-ray station on which we can see the digital X-ray examination, and it's very comprehensive to use because we can magnify the image, we can rotate the image, so and perform some measurements. On this image we can see the chest with a lot of different structures, and we can see something abnormal here. Can you say where the abnormality is? I cannot hear you. So first of all, before we will say where are the abnormalities, today we got topic also dedicated to the chest X-ray. So we must look at different structures that can be seen on this image. Looking at this image, I can even say the sex of this person. Do you think, is it female or male? Can we say, looking at this image, is it female or male patient? Is it possible?
So I can take a blind guess. Maybe it's a female.
Female, because it's very easy to say. We can see mammillary
Mammary gland.
outlines here, no problem.
Yes.
Not always can be seen, but sometimes. Then when we will look at the bones, we can see sharply clavicles, scapula. Here we can see the vertebrae partially overlapped by the mediastinal region, by the clavicles. Yeah, we can see the region of the lungs. Yeah, because today we are interested most in this region, in the chest. Yeah, we can see outline of the heart. This is the right part of the chest. This is the left part of the chest. The aortic arc, the left ventricle. And you must remember that all structure that can be seen in normal case in a intracostal spaces, here, 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 in normal case have vascular nature. It's a lung ileum, yeah, and you must remember that they have vascular nature. Diaphragm, the right level of the diaphragm is upper compared to the left due to the position of the liver. The cardiodiaphragmal sinuses, yes, the costodiaphragmal sinuses, they are free, very well visible. Now this is the normal, but yeah, it's not very easy to detect this abnormality. If we look and magnify this region, we will see that this is the broken central venous catheter that migrated into the right lower lobe of the pulmonary artery. And this metallic parts that you saw, this is just the parts of the upper clothes, which this patient forgot to take off. So this is not abnormality, and the abnormality is actually here. Not very easy to detect. And this is very easy to detect pathology. Right from the beginning, you can say the correct diagnosis. So what clues do you have?
Somebody put a coin or some metallic thing up their nose.
Battery, yes.
Battery up their
We
nose.
can use sometimes a watch or some laser pointers, such batteries. Probably a kid or maybe a teenager decided to just put it into his or her nose hole, and what we get in the result we can see here. So this material with a high atomic mass absorb X-ray waves, and result we can see bright radio opaque region. Again, another case, history of 11 years old, twisting injury of the foot. We can see here the part of the bone, the fragment, very well seen. And we can see here the fracture. It's another case, fracture, very well. But only in case when we magnify the image. That's why when we got digital device and digital imaging, it's very useful, comprehensive, because we can magnify the image. Sure, we must remember the anatomy very well of all organs and system of the organs, their parts. We must remember the names of the bones in order to assess not only the names of the bones like a cuboid, navicular, and so on, but also the epiphysis, diaphysis, metaphysis, cortex, and so on. Because the more detailed your report is, the better a clinicist may understand what you meant by your report. So it's very important to write always detailed report with a lot of details. As I said before, you must be able to name the epiphysis, the metaphysis, diaphysis, cortex of the bones, medullary cavity, yeah, and remember that always we use distal and proximal additions to every part of the bone, proximal epiphysis and distal epiphysis. Yes, it's very important to mention. As we already discussed on the previous images, this is chest X-ray. We know that the density of the lungs is air density. Yes, we will not discuss why, because you already know it very well. Again, the very great example of the fracture, very well seen. And you must remember that and what is the main job of the radiologist? Sometimes students, when they come to radiology paras before the quarantine, before the COVID, they sometimes ask me when we will go to patients. And I'm also a urologist, and the students of the 4th course, urology, and we attend the patients. But during radiology classes, I always telling to my students that the main job of the radiologist is not actually direct work with the patient, but yes, we can collect some anamnesis and conversate with the patient, but the main work is in writing the report, the assessment of the features of the different images, be able to describe all structures according to following algorithm, mentioning their properties, which parameters of each normal structure. So please remember this rule, because you will use it in your reports. Actually, during the quarantine, it's a little bit more problematic, but during the normal paras, all students usually work with the real X-ray images and write reports. So you may try to do it also during the preparations to your paras. And the golden rule of reporting is that any structure, normal or pathologic, should be analyzed for size, shape and contour, position, density, and you must know 5 basic densities and operate with the anatomical terms and operate with the such terms as radiolucency, radiopacity. Yes, more radiolucent, less radiolucent structure. If we will describe, for example, the lesion, like tumor in the bone, so we will say that this lesion got increased or decreased radioopacity compared to the normal bone structure of the same bone. Yes, or we may compare symmetric parts of the symmetric bones in order to describe the radio density or radiologic density. So remember, this is the golden rule. We will start analyzing the bone, musculoskeletal system, then we'll proceed to the lungs, then we'll proceed to the cardiovascular system, then to soft tissues, yes, to muscles, and some additional findings. It's when we talk about the description of the chest X-ray. If we talk about the abdominal X-ray, again, we will start with the description of the bone structure. Yeah, the bone position is normal. The size and shape of the bones is within the normal range. The position of the bones is normal. The radio density of the bones is normal. The bones are symmetric. Symmetric bones are symmetric. So this is the example. Yeah. If we talk about the kidneys, we assess it like we assess right and left kidney separately. Writing the right kidney is on a normal size, normal shape. The contour is regular. The position of kidney is normal, or we may assess the position of the kidney according to the last 12 pair of the rib and lumbar vertebrae, because there could be a decreasement or increasement of position, usually decreased. Yeah, the radio density of the kidney is normal, and we then proceed to the opposite kidney and describe. Yeah, and then soft tissues, muscles, and so on. If we see the other parts of urinary tract, like ureters or urinary bladder, we will assess them right after the kidney. Again, size, shape, contour, position. If we'll see accumulation of contrast, if we use contrasting, then we also describe how the contrast is treated, depending on the minute on which this contrast was administrated and the image was performed. So you will learn it later during the urinary tract X-ray imaging. The normal anatomical position, usually the patient stands. Usually we have, if we talk about the chest X-ray, different options for the X-ray imaging. The most common is the PA projection, is the posterior anterior projection, when the X-ray tube is located in front of the patient and the film is located behind his or her back. This is PA projection in the standing position. AP projection is vice versa, when the lamp is located behind the patient and patient is sometimes in the laying position, and this is more rare. Also, we may use lateral oblique projections. Again, I will not stop on this example of the bones. This is the abdominal X-ray. Abdominal X-ray, you can see without contrast. You can see different radio densities. I will not stop. I'm sure you perfectly know them, like air, like a mineral. This is stent. This is stent. This is artificial structure. Yeah, this is metal. Yeah, prosthesis. And sure, you can say, what density is this?
Metal, sir.
This metal density. Do you think, is it abnormal finding, maybe some foreign body, or it's totally?
So I believe this is most probably a piercing.
Yeah, that's correct. It's
Maybe.
piercing, yeah, in the breast. So we can see again female patient. We can see lungs, mediastinum, helium of the lungs. Usually right helium of the lung, of the right lung, on the lower level compared to the left, but in the 30% of population, it's on the same level, but more often like here. Again, posterior anterior projection. You can see the result of such an imaging PA. The lamp is here, the film is here, and lateral. The lamp is here, the film is here. Yeah, and we, in the result, we obtain projection imaging in two projections. If we will talk about the pathological findings, here we can see, for instance, patchy consolidation. In two projection, it's possible to assess the level, the size, the spread of the pathological finding. And if we will use only one projection, it will be impossible to tell in which segments of the lungs, of the right lung, the pathological lesion is concentrated. Yeah, so it's very hard to say, but in two projection, it's possible to say. Let's tell a few words about the computed tomography, but before that we must disconnect and then instantly reconnect to our session, because we got a limitation in a Zoom, 40 minutes. Okay, so I invite you to reconnect right now.